Good afternoon, everyone. I think we're going to get started. I'm attendees from the New England QIN-QIO, and I'll be moderating today's webinar. Thank you for joining us for today's Lunch and Learn webinar, Following the Roadmap to Success. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of this presentation. As I mentioned before, it looks like our mute capabilities may not be working perfectly today, so if you could do us a favor and just press mute on your phone, we would really appreciate it if you are not a presenter. And we'll take questions at the end, and I'll provide you instructions on how to unmute your line. At this time, I'd like to introduce today's speakers, Roby and Doreen Bedaw. Kathy is the Connecticut Home Health Lead for the New England Quality Innovation Network Quality Improvement Organization. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider clinical outcomes, reducing acute care hospitalizations for Connecticut home care providers. Doreen is the main home health lead for the New England QIN-QIO. She has over 20 years of experience in the healthcare field, specializing in quality improvement and project management. Please welcome Kathy and Doreen. Kathy, we're going to start with you.
Good afternoon, everyone. I do appreciate your joining us. I think that the change in time has come as a bit of a surprise to people, and many people may be signing on this afternoon at 2, expecting us at our usual time. Unfortunately, the schedule for our WebEx provider was very full. We will be sending out a reminder for going forward, as this time, this lunch and learn time, is likely to be the time we will be using in the future. However, as with all of our previous webinars, this will be recorded so that you can go back and replay it at any time that is more convenient for you. Slide, please. So, as Olivia said, we are the New England Quality Innovation Network. We are a quality improvement organization, the New England QIN-QIO. Such a mouthful, you know. We are the joint effort of health-centric advisors focusing on the Massachusetts, Maine, and Rhode Island group of providers, and Qualidigm here in Connecticut, working directly with the Connecticut, New Hampshire, and Vermont home health providers. Slide, please. So that as we continue to work, we have our website. It's here in front of you now, and we invite you to go to this link. This is a live link. Go to this link, and you will see, slide please, our home site for the New England QIN-QIO. Next slide, please. When you get to that website, you will find that there is a tab labeled for providers. If you click on this tab, slide please, if you click on this tab, what you're going to find is it will give you a list of all the webinars that we have already done. And that will enable you to go back and use these for training for your staff, use them to refresh your memory, and use them to help you as you work through the process. Today's topic is a roadmap for success. This is a tool that was developed by one of our peers from the state of Vermont, and it has been found to be highly successful in helping agencies to actively participate and take a positive forward role in implementing the 11th scope of work. And at this point, I'm going to turn this over to Doreen, who's going to lead our presentation today and talk about the checklist itself and how you can use it. Doreen?
Thank you, Kathy. Happy to be here discussing the roadmap with you today. This tool is a resource that's going to pull it all together for you if you're an agency that's just getting started, or if you have things well underway. You'll find nearly everything here that you need to keep you going in this initiative. As Kathy mentioned, our roadmap tool was developed by one of our colleagues, and I have to give her a shout-out. Thanks to Jennifer Gordon in Vermont. It's now in use in all of our 6 states in the New England Collaborative, and it's also been shared with the HHQI to make it available to home health agencies across the United States. So very exciting there that this grew out of our collaborative here. We've updated the roadmap to reflect some new resources and some additional guidance. We'll be working off the new version today, so if you're working off a version that you've previously downloaded or was emailed to you prior to today, please take advantage of the roadmap that was sent out today and linked in this presentation. Our main objective for this call is to review the roadmap, to explain how it helps to track your progress in this initiative, key resources that are identified for you for the initiative, and to show you how it moves you down the path to achieving positive outcomes for improvements in cardiovascular care. Let me turn your attention now to the roadmap document itself. You can see that it's set up with 5 sections that are aligned with the 5 cardio milestones that were set up by the HHQI for achieving a measurable improvement. I'm going to review what's in each of the milestones, give you some key points along the way, and explain to you how you'll know when you've completed a milestone. To track your progress, the roadmap is set up like a project work plan. You can see it's set up in sequential steps, which include a space for tracking the date that you've completed each of these tasks, barriers that you need to be considering, and an area for your own notes, maybe how you want to mitigate those barriers or additional steps that you would like to take for yourself. And the beauty of this is that all the resources and the various touch points for the HHQI, the data registry submissions, and us here at the New England Collaborative are all connected. So you don't have to figure out, well, do I go to the HHQI? Do I go to the QIN-QIO? Where do I find where to go next? That's all done for you here. So as you go down, you can systematically track where you are and what you've completed and always see where you need to be headed. And it's in a PDF format, but one that's fillable so that you can type right into this document and make it your own. Think about using the roadmap document regularly in your quality meetings as a working document. And it's also a good vehicle for communicating to others what it is that you've been doing and what you've accomplished. So the tracking part of this is fairly simple and straightforward. Next slide, please. Next slide, please. Milestone 1. Okay. I was trying to determine the best way to review the roadmap and decided that it really didn't look good to parcel it up and put each of the individual milestones or steps onto a slide. It would have been too small and much too tedious to go through that way. So I decided that really the best way is to have a slide summarize the key elements to each milestone and then spend some time referring back to the roadmap tool itself, and I'll highlight for you the essential steps and related resources and some important points. So milestone 1, join and learn. Milestone 1 is really all about getting started and getting connected in the initiative. In this milestone, you'll identify your project lead, do the initial registration, and then begin your engagement with us in the New England Collaborative and with the HHQI. So now, let's go back to the roadmap tool again and look at it together. We've had some agencies telling us that it's been a challenge to get started, and that's largely due to their needing to get organized internally. So take that first step in creating some ownership. Step 1.1 of the roadmap includes some suggestions for identifying your champion. And if you've already passed this point, don't forget about a backup person so that your project never comes to a halt when there's a vacation or transition in your organization. Excuse me. Step 1.2 is register to join the HHQI Cardio LAN. LAN is short for the Learning and Action Network. This is an essential step. It's going to get you all your news from the HHQI and the HHQI's invite. And the cardio lands they're such great programs. They're a robust learning opportunity for improving cardiovascular care, and they're delivered by experts in the field. If you're an agency who is already signed on and has been engaged with the HHQI and the cardio land, then you know the value of these programs. And I just want to remind you that the link shown here in the roadmap will also take you to the recordings of all of the previous cardio land programs. Our New England Home Health Collaborative webinars, as Kathy mentioned, are the second Wednesday of every month, historically from 2 to 3. We'll see where we go. And those webinars provide you with complementary information to what the HHQI is doing, and also an opportunity for peer sharing. So steps 1.3 and 1.4 are both introductory webinars from the Home Health Collaborative, reviewing the requirements for this initiative and some info to get you started. Step 1.5 is to take the Million Hearts Pledge to show your support of the CDC Million Hearts Initiative to prevent 1 million heart attacks and strokes by the year 2017. And Kathy is going to talk about that much later, so I'll leave that for later. So once you register for the cardio land and you begin to engage in the HHQI webinars and our webinars, you've completed milestone 1. Next slide, please. Milestone 2, access and download the BPIPS. Milestone 2 is all about continuing to get set up with the logistics to submit data to the registry and using the BPIPS, the best practice intervention packages. So we'll talk about the registration process for data access, some must-see webinars to help you with using the registry, and some additional education, including the BPIPS. Let's go back now, again, referring to the roadmap document. Step 2.1, this is essential. It's a separate registration for data access for the registry. And this is, by and large, due to the HHQI needing to maintain the strictest data security. And that's why they needed a second registration for the access. Step 2 and 3 are must-see webinars. One of them is from the New England Home Health Collaborative, which is an overview of the registry in context of working with a collaborative. And then the other is from the HHQI, and it is a very detail-oriented, step-by-step process on how to access and use the registry. And it's about, I think, somewhere between a 30 and a 40-minute webinar, but it is well worth the time to get very acquainted with the registry. Step 2.4 is to download the BPIPS. If you have not done this yet, there's a wealth of resource material here, including information, tools, and resources that you'll be using in this initiative to make a measurable impact on all the measures related to the ABCs of cardiovascular health. Step 2.5 has additional education on program integration, and that's really more of an optional step. Next slide, please. Now I'm going to turn this over to Kathy, who's going to talk with you about the roadmap as it relates to targeting your measures.
Thank you, Doreen. On the roadmap itself, you'll notice that we have placed this QAPI section in milestone 2, because it is at this point, now that you have listened to the webinars on what is on the Home Health Cardiovascular Data Registry, you've gotten a little information about what's included here, what kinds of data we're going to be collecting, what our role and our purpose is. Now we're going to be asking you to select a measure. How do you go about selecting a measure? How do you know what's going to be appropriate and interesting and beneficial for your agency to work on? The best way for you to make that decision in terms of selecting a measure that is the most appropriate one for your agency to work on, the best way is for you to have a really good understanding of what the data is telling you about your agency. Now, what data am I referring to? As you saw in the webinars, when you go through and you review the webinars that are available on the HHQI website, you will have seen that there is information already there, drawn from your submitted OASIS information regarding your acute care hospitalization, regarding at least the medication improvement stabilization measure, and it will tell you a little bit about how your agency is doing. It will tell you, in fact, in the drill down, it will tell you detailed information about your case mix. It will tell you detailed information about whether or not your case mix represents a very high-risk population for cardiovascular disease. It's going to tell you very interesting information about your hospitalization. Not only what your rate is in comparison to other providers around you, but it's literally going to break it down in terms of the day of the week, the month, what the trends are. Do you have peaks and valleys in your hospitalizations over the last year, over the last 12 months? Is there a trend that you have a high increase in hospitalizations during flu season? Perhaps you have an increase in orthopedic admissions during the holiday season. Could be those snowbirds returning home to spend Christmas with their grown children have forgotten how to walk on the snow and the ice and fallen and broken a hip. It's very important information for you to get, and it's all sitting there waiting for you. So how does this impact your decision on what measure is the most appropriate one for you to be working on? If you are running your CASPER reports on a regular basis, you will now be able to take your CASPER reports for the most recently closed quarter. This is now mid-March, so I would run those reports for the most recent data available. Then you're going to go back to the HHQI website and you're going to run the reports on your hospitalizations. Look at the detail reports. One of the first things you're going to see in the data is whether or not your staff are relying too heavily on other or unknown as the primary reason for the readmission. If they are doing that, if that percentage is the highest one in all the lists, then you definitely are not going to have data that will help you. So your first project is going to be reducing that unknown or other reason for readmission to as low as possible. It's more important for you to know that your patient was admitted for cardiac-related, respiratory-related, fall, infection. You need to know the real reason. And that may mean that someone's going to need to be detailed to getting this information by calling the hospital, calling the family, or doing whatever is necessary. In addition, you're going to want to analyze the day of the week, because this will lead you to look at how you are handling after-hours, weekend, and holiday calls. When the patient or family does actually think to call you, are they getting the impression when the nurse says, you don't really need a visit, do you? You can just go to the emergency room? As opposed to, sit tight, try to breathe slowly, I am coming, I'm on my way, and we'll figure this out. There is such a difference between the two. And potentially, hospitalizations are occurring that are truly avoidable. So the first step in deciding what you're going to do for a measure is that you need to look at what your data tells you so that your agency champion can select those target areas that you're going to work on and then identify which of the HHQI measures are most closely aligned to it. Is there one single method that works best? Do you TDSA in your agency, or do you use another method? Is your agency focused on using Lean or Six Sigma? Whatever your process may be, it's important that you follow the process. And the process does have essentially all the same elements. In the roadmap, we direct you to some sample forms and resources that the champion can download and use to obtain their data and to begin to analyze it. Because this is going to make a critical difference, as I said. When you look at the second step, it refers you to a whole series that the HHQI staff have created for you. It's called Paving the Way, and it will guide you step by step through the process of developing your own model and how to use that model as you go through the process of quality improvement. Slide, please. As I said, all the different processes have something in common, and it is essentially what you see in front of you now. The PI process requires that you first make a plan. What is it I'm trying to do? I'm trying to decrease my hospitalizations because decreased hospitalizations are going to improve my CASPER data. They're going to improve my patient satisfaction, which improves my star rating, and they're going to improve my scores for home health value-based purchasing, which is right around the corner. So what is it that the data predicts is going to happen? What is it that you predict you want to do? What is the plan that you're going to do to achieve that objective? What data do you need? Once you've answered those questions, you move on to the next step. You need to implement the plan that you created. If your target is to improve the cardiovascular outcomes by improving shortness of breath, improving medication compliance, decreasing hospitalizations, that's your plan. What are you going to do? You're going to find out what the real reasons are for hospitalization. You're going to look at the patterns. You're going to look at what methodology you're using to teach your cardiac patients about their illness. So you carry out the plan. You document the results. You record the data. Now that you have it and understand, you cannot expect change to happen overnight. We know CASPER data is at least 6 months old. So is Home Health Compare. You need to be patient with yourself. Change doesn't happen overnight. Change is hard. If it wasn't hard, we'd have all kept our New Year's resolutions, right? Unfortunately, making change is very difficult, not only for our staff, but for our patients. So we're going to have to take our time, implement our plan in steps, look at how each step goes, keep our eyes on the data, and then analyze it, comparing it to the initial baseline data that you're running today. 3 months from now, 6 months from now, you're going to analyze your new data. Compare the results to where you were and where you wanted to be. Look at how you implemented your change process. Look at the steps you took. Did they work? Did they not? If they didn't work, what made them not be 100% successful? As soon as you can identify what the impediments and the obstacles were, you will now be able to make some changes in that plan and start the next cycle of improvement, completing the circle. And that's the very bare bones of a performance improvement process. Whether you use a PDF, as I said, or Lean, or Six Sigma, whatever works best for your agency's culture. That's really where we come in. Those of us that are your designated home health leads in each state. I'm going to be turning this back over to Doreen momentarily, but I cannot emphasize enough. Change is hard. Using the data, understanding what it tells you, understanding how to build it into a plan, how to reassess the data, how to alter the plan, and keep it moving in that cycle over and over till you achieve your goal. And then you make a plan to continue to improve your goal. That's not easy, but we are all here to help you. And all you need to do is pick up the phone, drop us an email, send us a text, and we will come to you, work with you and your staff directly so that you can make this happen. So having given you the 40,000-foot view of the change process, I'm going to turn this back over to Doreen so that she can talk to you now about the quality measures themselves and how you will go about selecting one. Doreen?
Thanks, Kathy. And next slide, please, Olivia. So thank you for explaining how you're going to begin that performance improvement process and how you're going to use your CASPER data and reports to narrow down your selection for which measure you're going to select. And that's something I can't really tell you because obviously you have the reports, you have the data, and you know your agency. And with that explanation that Kathy's provided you, hopefully you'll be narrowing down your process to start with one or two measures that are going to make the most sense for your agency. So with that, let's relate it back to what's happening with the HHQI and the data registry. We'll complete the discussion of milestone 2 for registry access and then a download. And we'll briefly talk about choosing measures, but this time within the registry. Not to be confused with choosing measures as Kathy had mentioned before, but going into the data registry itself now, once you've decided on the measure and actually making that selection. When you log into the registry, you will have access to choose which measure or measures that you want to abstract. There are 2 cholesterol measures, one of which is specific to diabetes, use of aspirin, tobacco use and cessation, and a blood pressure control measure. And I just wanted to make a note that the blood pressure follow-up measure that you may have seen when you initially signed up for this initiative has been removed due to some feedback that CMS was receiving from home health agencies. So it's just the one blood pressure measure at this point. And then another decision point Kathy alluded to before is knowing how many months of baseline data you want to collect. And generally we recommend 3 to 4, but some agencies are using as many as 6 months of baseline data. It's really, again, whatever makes sense for your agency. If you're a smaller agency that may have fewer records each month to abstract, then you might need to go a little further with your baseline data collection. Okay, now let's move back to the roadmap document and refer to that. Step 2.7 is your measure selection in the registry, and it shows you the link to the specifications that the HHQI has provided for what episodes are going to be included in each measure. So if you're interested in taking a look at how an episode would qualify for a measure, use this link, and there's a separate link for each and every measure. Keep in mind, though, that the Cardiovascular Data Registry really does all the work for you, and it's going to have access to your episodes from the OASIS data that you submit to CMS, and so it's going to go through all of the episodes that you have submitted for the prior month, find out which ones match up with the measure that you've selected, and then present those cases to you. So you'll be all ready to go with your data abstraction. So to recap everything for milestone 2, once you've completed the second registration for data access, you've downloaded the BPIPS, you've gone through your initial planning phase of the PDSA that Kathy was describing, decided on what measure or measures make sense for your agency, and you've gone into the registry to select those measures, you've completed milestone 2. Next slide, please. Milestone 3, collect data and download. In Milestone 3, you're ready to implement your process for data submission and begin your intervention. You'll find in the roadmap an understanding of what elements are abstracted, tips on internal organization, and we'll talk about whether or not it makes sense for you to use a paper tool versus doing this whole thing paperless. And then closing your data submission and downloading a report. So let's go back to the tool once again. Step 3.1 provides you with a link to the paper abstraction tool, which shows you all of the data elements that you need to abstract and submit for each measure. Steps 3.2, 3.3, and 3.5 all provide you with tips on organizing internally for your chart abstractions. And one thing to keep in mind is that you don't have to have a clinical person doing these abstractions. Many agencies utilize administrative clerical support in order to do that step once they feel comfortable with the process. Step 3.4 indicates how to use the paper tool, but you can do this all electronically, as I mentioned before, and eliminate the paper. And the way that agencies do this is that they pull up the electronic record on one screen and then the registry on the other, and you can probably do this all on one computer and just toggle back and forth. And this is, in fact, what we believe that most agencies are doing. And it's just, it eliminates the paper and streamlines everything for you. Once you've submitted 1 month of data and run one report from the data registry, you've completed Milestone 3. Next slide, please. Next slide, Olivia. Thank you. Milestone 4, collect and validate your data at 6 months. Milestone 4 is all about continuing the process. We'll talk about how data entry follows a cycle on the 15th, the 14th, and the 23rd of every month, and also about making up for missed opportunities with your data submissions. Let's refer again to the roadmap document. Step 4.1 through 4.4 spell out the data submission cycle for you. The link takes you to a 12-month, or a document that shows you the 12-month cycle, showing which months of data entry correspond with which month of episodes of care you're in. For instance, the month is March right now, and if you were to click the link and go to that document, it will tell you that this month, on the 15th, that you will have access to January episodes to do your abstraction and data submission. And it will show you when the window opens each month of the year and when it closes, which is the 14th of the month, of the following month, I should say. So you're starting it on the 15th of one month, closing the 14th of the following month, and then it shows you when you can run reports, which is a week later about thereof after you've closed the month out. And before I had referred to missed opportunities with your data submission, and I just wanted to mention that if you miss the window of time, if you miss it completely, or you realize you only put in half of your records because you didn't have an opportunity to complete it, you ran out of time, you can always go back and you can do that month or finish off submitting all of your records, as long as you don't close the month. So don't worry about that. Step 4.5 is a link to an educational webinar to show you what to do once you have data reports from the registry. The data reports are great because they will pull down information and compile it from all of the records that you've submitted for each of the measures and show how you're trending month to month, as well as show you the national benchmark so you can see how you compare to other agencies nationally who are abstracting the same measure. Excuse me. Once you've submitted 6 months of data to the registry and you've run reports for one or more measures, you've completed Milestone 4. Next slide, please. Milestone 5, achieve noted improvement in one or more cardiovascular outcomes. So now that you have the data, what this milestone is all about is turning the focus on showing improvement. The PI process Kathy was referring to change cycles and making a determination for when you are ready to move on. So let's go to the roadmap once again. Roadmap steps 5.1 through 5.6 are all offering improvement strategies from various sources such as the BPIPS, patient education, staff trainings, and community education. So, please be sure to take a look at those. Earlier, when Kathy was discussing performance improvement systems such as the PDSA or whatever system that you're using, you'll need to be thinking about where you are in that improvement cycle. And you're likely, after you've gone through 6 months of this, to have made it through once, but you need to be, again, thinking about where you want to be headed. Have you achieved your meaningful improvement? And if needed, you might find that your agency is going to go through multiple cycles, again, as Kathy referred to get to where you want to be. And the resources are all outlined here, and with improvement strategies to get you where you want to be. So once you have a measurable improvement in one or more cardiovascular outcomes, you've achieved milestone 5. And then don't forget to determine how you'll maintain the gain. These are the kind of gains, as we like to say, we want to keep those gains. So if you've made gains in a measure, just make sure that you've figured out how to sustain that as you go forward and take on a new measure. Next slide, please. Just want to take a moment to highlight a few additional resources that are not on the roadmap, and perhaps we'll find a way to include some of these, a resource listing that's in addition to the 5 cardio milestones. The first one is our ICMI newsletter, in case you missed it. The newsletter is issued monthly and will come to you by way of an email from your local state home health coordinator, and it gives you important dates. It's going to highlight all those important dates of the upcoming webinars, the data registry dates, when the registry closes, when to run your reports, and so on. And we'll also provide you with news from the collaborative, from the HHQI, and then also news from our Safer Care Transitions Initiative that some agencies have elected to join. So it really capsulizes everything that's going on between the New England QIN-QIO and the HHQI relative to these initiatives, and we try to summarize it in a compact form to help you stay organized. Kathy mentioned the HHQI University before, and I wanted to underscore how great I think that is. They're always putting out new course materials, like the Pave Your Path series with introduction to PDSA, and they did that in conjunction with the IHI, so it's really a great course series, as well as the CLAPI. And how great is it that they gave you a free course series on CLAPI, and they used cardiovascular health as the model tip that they wanted to discuss. And so putting that all together with the roadmap and engaging in this initiative, which provides you with data-driven quality improvement, it really positions you nicely for those new CMS conditions of participation that are on the horizon. And then, as always, those courses are free, and there's free CEEs associated with them. Then the other thing is that they just recently uploaded 10 video BPIPS to the BPIPS section of the main menu. And those 10 video BPIPS are really short. Some of them are 2 to 3 minutes and others are 10 minutes. And some are targeted at educating your professional staff, while others are short patient videos that you can take right in to the patient's home with you to help keep them engaged and activate your patient. Our own QIN-QIO website that Kathy already talked about, and then the HHQI is just fabulous with using social media. They're on Facebook, Pinterest, and Twitter. And one thing I forgot to mention is that they have their own YouTube channel, so that if you want to access any of their videos and you're not near your computer with your login, you can actually go to their YouTube channel and find it all right there. And then, again, to underscore what Kathy mentioned before, is utilizing your state home health program coordinator to help you with any and all parts of this process. So now I'd like to turn it back over to Kathy.
Thank you, Doreen. Next slide, please. So here on the next slide, what you have is a list of each of us by the state, so that you have our names, our email addresses, and we're hoping, Doreen and I and all the rest of the group, that you're going to reach out and touch someone, that you're going to type an email to us, you're going to pick up the phone and call us, that you're going to invite us to work with you. We're here to be your partners. It's perfectly fine if you haven't done a thing with this project since you signed your letter saying you wanted to be a participant. It's fine. Between face-to-face and ADRs and home health value-based purchasing and all the other challenges that you're dealing with on a day-to-day basis, let alone covering the cases that need to be seen and meeting payroll. We know how hard it is. All we are asking you to do is reach out to us, and we will help you to find a way to fit this project into work that you are already doing. We will never ask you to do something that's going to be additional work. Rather, our job is to help you find a way to incorporate this into what you're already doing, so that you can be an active participant and you can use all these wonderful resources and tools and videos and the YouTube information, all the different things that are out there for you that will make it easier for you and your staff to improve the cardiovascular health of your patients and to improve your outcomes, which will do absolutely everything to improving your star ratings and improving your score for value-based purchasing, so that you will benefit in a literal, provable way by implementing this program. And we're here to help you do that. Next slide, please. As Doreen mentioned, the Million Hearts Initiative is a part of this project. Way back in the beginning, when we first started recruiting people to join us in this project, we asked that you go to the Million Hearts website, and if nothing else, that you check off the box that says, I support this initiative. So how does supporting the Million Hearts Initiative relate to the home health quality improvement measures? I would venture to guess, and I did take a quick peek to look at the list of our attendees today, and what I'm finding is that almost everyone who's signed in, although I did hear a couple of male voices earlier, but just about everyone who signed in is a woman. And you know, 1 in 3 women are going to die of avoidable heart disease. So joining the Million Hearts Initiative is a matter of survival for all of us. If we can reduce our blood pressures, we can reduce heart disease. And whose blood pressure didn't go up every time you deal with getting a face-to-face or deal with getting your CASPER results? Reducing cholesterol is going to reduce heart disease. But I've been working like a madwoman all day, and it's 2:30 and I haven't eaten since yesterday, so I'll just roll through the Wendy's. Please buy the salad. Even though it's not the best, it's better than the double cheeseburger. And if you or someone you know is still smoking, the first and most important step to staying out of the hospital is to stop smoking. Next slide, please. So we're hoping that you're going to join the Million Hearts Initiative and that in your agency itself, you're going to find a way to bring your staff together and make this an active part of their everyday association with your agency. Pick a simple theme for the Million Hearts Initiative. 1 in a million. A healthy heart is a happy heart. The red team. Whatever you would like to call it. But start a theme for this initiative and make it part of your agency's culture, because it in turn will roll over and appear in every conversation your staff has with their patients. A walkers group is the easiest one to start. At Qualidine, every day at 12 o'clock, there's a loud thunk as the fire door opens and a group of people proceed to march down the stairs, all 4 flights, and back up again. This is the noontime steppers. They go out, they stay inside the building, so weather's not an issue. They go out of our office, down the fire stairs, all the way down and all the way back. Even if that's the only exercise they have time for. That brief pause and doing it together is so refreshing that the group is getting larger every day. Draw the link for all of your staff that heart healthy is heart happy at home, not in a hospital. On the Million Hearts website, there are all kinds of catchy phrase posters. They're all free. You can pick from the selection, order them, and then post them all over your office to increase motivation and participation. Identify a champion. One of our administrative assistants has taken this on as her New Year's project. And almost every day we get recipes in our email from her. We get little tips. We get hints on how to stop and stay off the smokers list. We get encouragement to join the steppers. We're having a monthly heart healthy lunch when everyone brings something from one of those recipes and we all share and have a lunch together. These are simple things. They bond your staff together. They improve the culture within your agency, and they show your commitment to the Million Hearts Initiative. It's a wonderful thing to do, and it will have a tremendous positive impact on your agency culture. Even without the link to our Cardiovascular Initiative, it's a great thing to do. Slide, please. So that brings us to the end of today's presentation. I get off my soapbox now and promise to be good. We're open for questions. If anybody has a question that they would like to ask, either Doreen or I, we're happy to take those questions for you over the next few minutes. And as I said before, all of us in the Home Health team are anxiously waiting to hear from you. Olivia, can we open the floor for questions?
Yes, thank you, Kathy. So at this time, we'll take a few questions for Kathy and Doreen. If you'd like to ask a question, please press pound 6 on your phone to unmute your line, or if you had manually muted your phone, please unmute. You can also post a question in the chat box.
I'd like to find out if we can get a copy of the slides sent to us.
Yes. If you check out the chat box, I have posted the link to the slides, to the presentation itself, as well as the roadmap. It was also included in the last call email that you got this morning, and it will be posted again in the thank you email that you'll get tomorrow morning as well.
Wonderful. Thank you.
No problem. Is there anyone else that has a question for Kathy or Doreen? All right. It doesn't sound like we have any more questions. Doreen, would you like to talk about the next webinar really quickly?
Yes, I would. Thanks so much, Olivia. Next month, we're having a very special program. And again, it's not in our usual time slot, but we'll send out a notice and confirm the time with you. It's a panel discussion with 3 home health agencies in our New England Home Health Collaborative that will be sharing advice on succeeding with cardiovascular coffee. So they'll be sharing how they have proceeded in this initiative and what kind of innovations they have developed in order to improve cardiovascular care. I think it'll be a great discussion. I know I always look forward to hearing how my peers are doing something because there's always something new I can learn and adapt from that. And then I also wanted to give a plug for the program that the HHQI is doing next month. It's a special program. Their cardio lands are generally 1 hour. This is a special 2-hour event on exercise prescription for heart failure patients. And it's going to be providing information to the attendees to receive interdisciplinary information, as well as HHQI is applying for nursing CEs and for the first time CCUs for the therapists. So I think that'll be a really great event.
Thanks, Doreen. And thanks everyone else for a great discussion. I just have a few last-minute announcements before we end today's call. When you close out of this webinar, the evaluation will automatically pop up in your computer. If you could please fill that out, we would greatly appreciate it. And if you don't have time to fill out the evaluation right now, or you're currently sharing the computer with someone else, you'll receive an email tomorrow morning with the link to the evaluation, as well, as I said before, the link to the event page on our website where the presentation is. The PowerPoint is on our website, and within the next few business days, a recording and a transcript will also be added. And be on the lookout for emails about our next webinar in April, as Doreen just has discussed. And thanks again for attending, and I hope you all have a great day.